Okay, so for a physical exam, thoracic auscultation, we're going to do the stethoscope to listen to the chest and heart. You're going to place the diaphragm of the stethoscope caudal to the point where the elbow meets in the chest. You're going to hear, like the dog's significant lub-dub sound. You're going to count how many heartbeats you hear in 15 seconds and then multiply it by 4 to get your heart rate. To check the lungs, just like the dogs, you're going to check for any wheezing, crackling, or popping noises. The breathing can be heard equally on the left and the right side of the thorax. And to get your respiratory rate, you're going to count the number of breaths in 15 seconds and multiply that by 4. To get your pulse rate, you can place your fingers here and count how many pulses you feel and multiply that. In 15 seconds, multiply that by 4. For eyes, just like with the dogs, you're going to check the eyelids. You can identify redness, swelling. The eyelid margins can be evaluated for masses or abnormal hairs. The lower eyelid, you can check for ocular discharge. That can be noted squinting or tearing. So for ear exams, visualization and palpation of the pinna, it can be evaluated for symmetry. It can be inspected in and out for swelling, redness, or alopecia, but she has a little bit of debris in there and some crusting. You can lift and pull back the pinna. That will allow visual inspection of the external ear canal. The canal can also be checked for swelling or masses. And then this is checking the canal with the otoscope just to check for any swelling or discharge. The abdominal palpation, you can use your index fingers and lightly press along the abdomen. It's the same for the dogs to check for, that I explained, to check for the liver, the kidneys, the bladder, the small intestine, large intestine, stomach. Checking the integumentary system, you can check and examine the hair, skin coat for normal hair coat versus dull, greasy, rough scales or flakes versus thinning alopecia. You can also check for fleas. She's got a little bit of dandruff, but no crusting. Lymph nodes can be checked for enlargement. It's the same as dogs. Check if they're firm, warm, or painful. If they're normal, they're going to be round, slightly movable, firm, but compressible. So just feel different lymph nodes. There's some back here. And you can turn it. I know. Here, which those all feel normal. Her joints, you could check and palpation of each limb, extension, but she's not showing any signs of limping. An oral exam we can do. Use caution when doing it, but you can just lift the lips and check the teeth for any fractures. Tartar discoloration, you can palpate the abnormal teeth to assess pain, loose teeth, examine. This patient has an ASA grade of a 1. She's healthy, showing no signs of pain or infection or anything abnormal. Exam, we're going to start with a rectal temperature. We're going to lube the thermometer and stick it slowly into the anus. So our general body condition and mentation should be observed and noted during history taking. If they're strong, healthy, weak, bright, alert, responsive, dull, depressed. Any gait abnormalities, muscle atrophy, or asymmetry should be noted while observing the animal during history taking as well, and also be examined hands-on. For our thoracic auscultation, we're going to take the stethoscope and we're going to place the diaphragm of the stethoscope piece caudal to the point where the dog's left elbow meets the chest. You'll hear a distinctive lub-dub sound. That's normal for the heart. And then to count the heart rate, you can listen for 15 seconds and count the number of beats you hear and then multiply it by 4. To check the lungs, you can check, you'll hear a soft noise for normal lung sounds versus any wheezing or crackling or popping sounds. It should be heard equally well on the left and right side of the thorax. To count the respiratory rate, you'll do the number of breaths in 15 seconds and you'll multiply that by 4. To do an exam on the eyes, you can check the eyelids to identify any redness or swelling. The eyelid margins can be evaluated for masses or any abnormal hairs. The lower eyelid can be examined to identify if the dog is entropion or ectropion. So if the eyelids are going inwards or outwards. You can check for ocular discharge that needs to be noted, any squinting, any tearing, any redness, any other abnormalities that might show that there's something else going on with the eyes that's not normal, but her eyes are healthy. You can check for any cloudiness, anything like aging, changes, things like that. For ears, you can do a visualization and palpation of the pinnas. You can evaluate for symmetry, inspect in and out for swelling, redness, alopecia, crusting. You can lift and pull back the pinna. That will allow visual inspection of the external ear canal. And you can check the canal for any thickness, swelling, masses. You can use your otoscope to check down in the ears. Abdominal palpation, you can use your index fingers like this and palpate the abdomen. There are some things that are more palpable than others. If the liver is enlarged or contains a mass, it will be more palpable. The spleen is palpable, the kidneys are palpable. With kidneys, you can check for irregularities in size or shape, or evidence of pain when palpating is usually a sign of an abnormality. They'll usually tense up. The bladder can be easily palpable, assuming that it's not empty. You can check for distension or thickness. The small intestine is generally palpable. You can feel it as it loops past your fingers and more of the mid-abdomen area. The large intestine is palpated in the mid-dorsal and caudal dorsal abdomen as it courses towards the rectum. The stomach is not usually palpable unless it's full or you feel any masses or irregularities. Integumentary wise, you can examine the hair, the skin for normal hair coat versus dull, greasy, rough, scaly, flaky hair coat. You can check for thinning, alopecia, infection, redness, thinning, irregular thinning, and you can inspect for fleas as well. The lymph nodes, you can check for enlargement. If they're firm, warm, or painful, that's usually a sign that something is going on. If they're normal feeling, they'll be round, slightly movable, but firm and compressible. Musculoskeletal system, you can check the joints in our geriatric patients if they show signs of limping, or if you notice on a dog when getting a history that they have any swelling or abnormal gait. But you can check the joints and do some flexation of the limbs. And then a lot of the times if they have any issues with their spine or neck, you can press down on every vertebral column and they can usually wince or they'll show a sign that they're in pain if there's something up there going on. For oral exams, you want to use caution, but you'll usually just lift their lips and you can check the teeth for any fractures. There we go. You can check the teeth for any fractures, excessive tartar, discoloration. You can normally palpate abnormal teeth to assess pain and check for loose teeth. You can examine the gums for redness, swelling. That'll show gingivitis, gingival swelling. You can even press their gums to tell if they're dehydrated or if they're pale at all. To get a pulse, you'll place your fingers right here, and you can multiply the number of pulses you feel in 15 seconds by 4 to get your pulse rate. This patient had an ASA grade of a 1. She was healthy, not showing any signs of any pain or discomfort or any abnormalities. So for maintenance on our autoclave, we have a weekly maintenance, which to clean that is cleaning our chamber and then the trays. So you'll drain the water from this reservoir using the drain tube located on the front of our unit, which is right here. And then we wash the inside of the chamber and trays with mild soap, or we speed clean it with distilled water. And then we'll fill the reservoir back up with the distilled water that we keep under here, our supply of distilled water. And then that's weekly maintenance. For our monthly maintenance, we do a clean chamber and then we do plumbing. So with the cooled chamber, how it is right now, we drain the reservoir, which is all the water, distilled water in here, and the dirty water and liquids that the autoclave has, and we'll fill it with clean distilled water. Then we're going to add an ounce of Speed Clean sterilizer cleaner directly to the bottom of the chamber. After we're done with that, we're going to run like we're running a pouch. We're going to press pouch and start and let that run. We're going to press stop whenever the drying portion of the cycle begins. We won't let that part happen. We'll press stop, and then we'll drain the reservoir again, and we'll refill it with clean distilled water, and then we will rinse by running one of the unwrapped pack cycles. After that one's 100% completed, we'll drain and refill the reservoir again with the clean distilled water, and then we'll allow the sterilizer to cool. Then we'll remove the trays and the tray rack, and we'll wipe it off with a damp cloth. We'll remove and clean the filters that are up in here, and we'll wipe out the inside of the chamber using care not to damage the heating element. And then the steam temperature probe and the level sensor probe, and then we'll reinstall all the filters and the tray rack when we're done. And that is what we do for our monthly cleaning and maintenance.